Swaddy Krupp. Not every day in Thailand is all sunshine. This morning we've got a little bit of cloud and a fairly strong onshore breeze washing onto the west coast of Phuket. Once again we're at the Intercontinental here in Kamala, and today Sumi and I are going to be taking a lot of your questions. Welcome to Good Morning Thailand. And good morning Thailand, our second day at the Intercontinental. Thank you very much for joining us here in Kamala, Phuket. And we're just about 80 metres away from the actual beach. And with me today is Sumi Surian.
Good morning, Tim, and good morning, Thailand.
Tourism and hospitality consultant, basically knows everything about what's happening with tourism and the hospitality industry, and great to have you and your expertise on the program today. Now we're going to actually spend a bit of time today really focusing on people's comments and questions, and we look forward to answering as many as we can today. We'll work hard. We say hello to Brad, to 3D Ping, to some of the same people saying all the same things. Jay, Smoke from 7 Officers. We've got Lloyd, we've got Kimberly, we've got Kev, Rusty. Great to have you all there. There's a lot more people, and we thank you for joining in. And all the way from Bangkok, the senior writer for the Thaiger, Caitlin Ashworth. Thank you for joining us.
Thank you.
Caitlin, we're just going to start with a bit of sombre news today, and we're just going to go through these numbers before we have a talk about the situation up in Bangkok. But a bit sad to report, Sumi, that around the world today we've kicked through another milestone, which is over 4 million people died from COVID-related deaths. The actual number of people who have been infected over the past 14 or 15 months is now 186,296,000. But 170 million people have recovered, and of course the vaccines are starting to kick in. Can I go with this particular graph, Jay, there, the one that shows the daily cases? And you can see in this graph that we've had a lowering of the number of daily cases as the vaccine rollout, particularly in the USA, has kicked in, and there's been a sharp decrease in the number of daily cases. But with this Delta variant starting to kick in, it seems that there's now a new trend, and the trend is on the way up. But if we go to this third graphic, this is the worldwide COVID deaths, and we can see that is continuing to trend down. So whilst there are people still being infected, a lot of people now are starting to be vaccinated, so the number of deaths is decreasing sharply. So that's the sort of graph we want to see. However, I suppose we need to say around the world we're not out of the woods yet. Now, Caitlin, we've got the numbers. Have you got the numbers in front of you for Bangkok?
Yes, I do.
I just came up with this great idea. I thought, for Thailand, I thought, I'll get Caitlin to tell the numbers. Would you like to share those numbers today, because they're not particularly good?
Sure. So today in Thailand, the CCSA has reported 9,276 new cases. Now, this is extremely high over the past several months, and this is due to the Delta variant, which is mostly spreading in Bangkok, but it has quickly spread to other provinces. While Bangkok remains the epicenter of infections, yesterday all 77 provinces in Thailand reported new COVID-19 infections. And many people who are in provinces outside of Bangkok had recently traveled from Bangkok.
Yeah. Okay, so we've also got 72 deaths to announce today. Very sad figure, the highest number we've had. 278 of the cases announced today are from Thai prisons, so still a problem in the prisons there. So, Caitlin, let's go to the situation there. I understand there's a meeting at 10 o'clock today with the Prime Minister and the WCSA. What are they going to be discussing?
Well, they're going to be discussing a proposal from the Public Health Ministry. Now, this is a proposal to put in some new restrictions, specifically to limit travel, since there's been an uptick of cases in other provinces involving people who had traveled from Bangkok. And the CCSA has been urging people repeatedly to avoid travel. Now, with lockdown, well, I don't want to say lockdown measures. But
don't mention the L word.
Don't mention that. But with restaurants now only being able to do takeaway orders, and just all the businesses being closed, many people don't want to be in Bangkok. They want to go back home.
Yeah.
So people aren't really listening to the advisory saying, please do not travel, because they want to get out of here.
Yeah.
So the measures that they could impose today are likely to be those that involve travel, interprovincial travel, and other things that would limit people from moving around. And people have said that these might be similar restrictions to those that were set back in April of 2020, during the first wave of infections.
All right, Caitlin, Sumi's got a question.
Yes. So we've got readers like Steve Schertzer and also Gordon Duncan just thinking that might be a lockdown after the meeting today. And the lockdown is, we're talking about mobility, restriction of travel, because as it is already in Bangkok, I mean, a lot of the, restaurants are closed and malls, it's pretty quiet there at the moment.
It's sort of a lockdown, but without saying the word lockdown. Do you think there's going to be some more, apart from travel restrictions, Caitlin, do you think they'll impose additional restrictions on businesses opening, like reducing shopping centre hours? Have you heard any scuttlebutt?
Yeah, some business owners are saying that they are preparing for their hours to be restricted, but still it's kind of up in the air. But I believe that's maybe some hours will be cut down.
Okay.
As it is, I think, people are already keeping a low profile and staying home. A lot of people who are working from home as well. So I think people are preparing and are aware of the rising cases in Bangkok and taking precautions.
Good morning to the members of the Thaiger, our legends and Tiger Cubs. Ed Anderson is one of them, and he says, don't these terrible numbers mean that the PM's 120-day opening plan is moot? Yes, well, of course, a couple of weeks ago, the Prime Minister was saying, look, we've got things under control and we're going to try and have most of Thailand open by the middle of October. The situation at the moment is probably going to just push that date back a little bit. I think the Prime Minister was acting in good faith at the time, but the situation changes, and it's certainly changed the last couple of weeks. Caitlin, around Bangkok, what's sort of the vibe? Are people staying at home? Are people getting out and still, I don't know, what are they doing? They can only go to the shopping centres, the restaurants aren't open.
Actually, people are going to the mall still. I just went yesterday. There are still people. If you go out, walking to work, there are still people going to work. People are on the streets. There's still street vendors selling food. So people are still out there, but they are abiding by the rules where you can't go and you can't sit in restaurants. But people are still outside. I think at this point people are kind of just over the whole situation, and also vaccines have been limited in Bangkok. Now, like where you are in Phuket, they've been very aggressively rolling out the vaccines.
Correct.
But in Bangkok, right now, I mean, the percentage of people who have been vaccinated is very low, and now with a limited supply of AstraZeneca vaccines this month, they can only focus on people who are at risk, and they're going to try to focus on those at-risk groups in Bangkok over the next 2 weeks. But I'm not at risk, unfortunately, so I can't, fortunately, but I can't get a vaccine right now.
Caitlin, with that, we'll probably say goodbye to you. You're up in the Thaiger offices in Bangkok. We thank you very much for your time this morning. And, of course, we'll publish all the latest news about that meeting at 10 this morning. And you can read it on the Thaiger. And I dare say that Caitlin and her team will be on to that as soon as the information comes to hand. Caitlin, thank you very much.
Thank you, Caitlin.
Thank you.
We'll see you later. Caitlin Ashworth there, senior writer for the Thaiger, bringing us up to date with that meeting this morning. Sumi.
Yes. So I've got a question here from Bill Polar Punt. So the question is, can people after 14 days leave Phuket, and how does the travel restrictions affect the Sandbox?
That's a really good question. I don't think we know yet, because the whole idea of the Sandbox was that after the 14 days you would be able to then travel anywhere around Thailand. Now, if they're going to introduce travel restrictions, that may make it a little bit more complicated. So we don't know how it's going to affect things. I think, I don't know, this is pure speculation, that the travel restrictions may involve those inner provinces, the central provinces right around Bangkok, more so than other ones. But look, I really don't know. Maybe they're going to say no interprovincial travel. But then again, if you're here for 14 days and you have to spend a bit more time in Phuket, you're stuck on a tropical island. It's not the end of the world.
No, it's a paradise here, so I wouldn't be complaining.
I wouldn't be complaining at all. So we don't at this stage know about how it's going to affect the Sandbox, how it's going to affect, if at all, the reopening of Samui and the other two islands in the Gulf of Thailand. They're reopening, I'm just looking at that, 6 days from today.
Correct. So 15th of July.
Let's have a quick break. We'll come back. We've got some other things to talk about, and we will get to your questions. If you do have a serious question and you're not just sort of having a chat to your friends in the chat section there, please write the word question in big bold letters, and it just makes it a bit easier for Sumi and me to find it. Got Sumi Surian here in the, well, not the studio, the breakfast area at the Intercontinental Hotel, and we've got you at home wherever you are in the world, and we'll be back right after this break. Welcome back to Good Morning Thailand, coming to you from the Intercontinental, right on the beach at Kamala. And as you saw at the start of the program, a bit of a wet and wild day to kick things off, but it's actually starting to see a little bit of blue sky out there. Sumi, we've got a few questions.
Yes, we do. Lots of questions about Sandbox. So I've got here from Jay. So his question is, he wants to go to Thailand for 6 months in October, and what visa do we recommend? So I would suggest the first thing to do is to contact your embassy in your own country, and then also contact a visa travel agent to decide which visa will be appropriate for your travels.
I think the situation is that the Sandbox is only for people on a tourist visa. Now, you can, in some cases, change a tourist visa into another visa, but usually you'd have to leave the country to do that. That's clearly complicated at the moment. So if you do want to come to Thailand for a longer stay, at the moment, the best thing you can do is to contact your embassy and, as Sumi said, a visa agent, a qualified visa agent. Ask around, do your homework. Another one?
Okay, so another one is, which is quite interesting because this did happen. So what if someone tests positive in Phuket on day 13? Will the close contacts of those people that the infected person has been with, continue to stay in Phuket for longer than 14 days?
I don't think we can answer that. What hasn't happened yet, nobody's been here in the Sandbox scheme for 13 days.
Yeah.
Look, clearly they are trying to make sure they're controlling the situation very tightly.
Correct.
And if there is somebody who turns up to be infected, they are going to try and limit the movement of the people who they've had contact with. It's just the way things are at the moment. It's not ideal. It's not like it used to be, but it's, I think, the best the Thai government can offer at this stage.
Yeah, exactly.
Well, while you're checking that, this is another interesting phenomenon that has occurred over the past, over a year now. We've got some people doing some amazing things in communities right around Thailand. We just saw a Facebook page of a gentleman quite randomly yesterday, and he was just doing his own little thing. So just want to pay homage to some of the people who are doing remarkable work, most of them without any thanks at all. Let's roll tape. There's no doubt there's some major suffering around Thailand at the moment, with some of the most popular tourist areas being the most hardest hit. But when the going gets tough, the tough get going, and some outstanding people in our community, including a lot of foreigners, have simply rolled up their sleeves and done whatever they could to help those less fortunate get through to the next day. Some are larger organisations, some are just individuals, like Bernard and Apple, living in Pattaya. Bernard is originally from Auckland, New Zealand, but has been living in Pattaya, Thailand since 2010. Together with a generous patron in Sweden called Sebastian, they've been heading out at first light every day since August last year and delivering around 100 meal packs to impoverished people in their local community. And when we say impoverished, we mean really destitute, living on the streets with nowhere to go, trying to cope day to day as the lights of the seaside city remain dark and businesses fester. We asked Bernard about the situation around the city. He said it was desperate, with no official help for people. Bernard said the situation involved hundreds and hundreds of people. Bernard and Apple, with the help of Kun Sun, deliver boxes of khao mein gai. On the weekend, they can deliver up to 150 boxes personally every day. Bernard asked me to thank the community of the Union of Pattaya Motorcycle Clubs and Odin's Nomads Motorcycle Club in Sweden. To all the people like Bernard and Apple who have been rolling up their sleeves and helping their community survive during this pandemic, the Thaiger salutes you. So a big thank you to those people who are doing some amazing work in their communities, and it's literally all around Thailand. Some people are just doing it rough at the moment, people particularly who were immersed in the tourism industry some 14, 15, 16 months ago, who just have had no work and are truly suffering. And we need to acknowledge that it's not just everywhere that's coping okay in Thailand. There are some pockets that are doing it hard. So thank you to Bernard, thank you to all the people who are doing that great work. And underneath we've got contact. If you do want to contact Bernard, that's up to you. Sumi, let's get into some more of these questions.
Okay, so I've got a question here from Jaso. He says, my hotel says that since if I come to Phuket on the day 15th, I need to do swab. So where does he find out the Phuket swab appointment center or the system is? So I believe there are 5 swab centers in Phuket, and the hotels will be able to point you to the closest one near you. So I know there's one in Mai Khao, in Laguna, Chengtale. So Mai Khao is up north of Phuket Island, and then you've got Patong near Jangsilon, as well as Kata Center, and then Phuket Town in the middle of the island. So they're all pretty accessible.
And be assured, your hotel will know exactly what you've got to do. They've all been very well briefed, so there's no lack of information in that regard. And you probably have prepaid for those COVID
Correct.
tests anyway before you could get your certificate of entry. I've got one here from Grammar Officer Krupke, who says, what's the cheapest available option for area quarantine, Samui or Phuket? Yeah, there are still ASQ hotels. Samui or Phuket, which would be cheapest? I suppose Phuket, because it's got so many more hotels, may have a greater range of cheaper options. You're going to have to jump onto your Google machine to find that out, and maybe have a look. If you contact your embassy, for example, they'll be able to put you onto the various websites and the information that you need to know for ASQ hotels. There's a lot of information online about that. We might see if we can dig out the link to the ASQ hotels. What do you think? Samui or Phuket's going to be cheaper for an ASQ quarantine?
I think you can get a wide range of hotels. It all depends on what you're after, lifestyle and, environment.
You'd also have to look at the cost of getting to either islands. And of course, with Samui, you're going to have to fly through Bangkok and transit on Bangkok Airways to Samui, which sometimes can be a bit expensive. But I don't know, I'm sort of guessing that you've just got a bigger range of hotels at the moment in Phuket.
Yeah.
Okay, to you.
Okay, and I've got one here, a question about golf quarantine program. Do you know anything about this, Tim?
I think I read something. They did have
William.
the golf quarantine where you could go to a golf course. You'd stay there for 14 days. During the day, you'd be able to go out and play golf with other people who were also in the quarantine situation,
Right.
and with a mask on, I'm assuming.
Yeah.
And then after 14 days, off you go. You've done your quarantine. I read something that they may have stopped the program.
Yeah,
but
apparently.
that's
Yeah,
we're not 100% sure.
Correct.
Because we're just sitting here just riffing with the knowledge that we have. We are sort of immersed in the news every day. We usually get most of it right, but not 100% sure about the golf quarantines. Sorry. Ed asks, there was a rumour floating around that American citizens would be given some of the vaccines that will be donated from the US. Do you know if this is true? The whole concept of expats living and foreigners living in Thailand and being assisted by the embassies has been a bit of a raw nerve for quite a few people. Currently, I believe there's only 4 countries that are assisting citizens with vaccines. China, France for over 55s, Switzerland, I believe, China, I think I mentioned China already.
Yeah.
There's another one, I can't remember what it is, maybe, I can't remember. But that situation is very fluid. Most embassies are saying it's not our responsibility, not our problem. So that is, again, a fluid situation. I know there's been a lot of American expats working really hard to try and get the government there to give them free vaccines, but it hasn't transpired at the moment. At the moment, I understand, Ed, that they are not currently being able to provide vaccines. We're going to have another quick break, and then we'll come back with Sumi, Suri and me, and the team here at the Intercontinental at Kamala in Phuket. Back right after this. Tim was sad. He had time on his hands, but didn't know where to find the news. But then he remembered. The Thaiger app, all your Thai news and Thaiger videos in one place. Just a single click takes you to a one-stop connection to all the news and information in Thailand. Now Tim is happy. Available free on Apple and Android, hologram not included. Thank you for joining us on Good Morning Thailand. And just during the program, the weather's got better by the minute and seeing quite a lot of blue sky out there, although we do have the southwest monsoon in full force, providing a bit of a vigorous day on the beaches. Question from Franklin, who says, Tim, can you confirm that 1 AstraZeneca shot is enough to travel to Phuket? Yes, at the moment,
Yes,
the government's saying that if you've had 1 shot of the 2 doses of AstraZeneca, you'd be able to travel to Phuket as an expat or a foreigner, and you'd be able to get access to the island. If you've had the Sinovac vaccine, you've had to have
2
had
doses.
both doses. But with the AstraZeneca shot, if you've had 1, you have to wait for 14 days
Correct.
until you can travel to the island. Thanks for the question.
Okay, and I've got here from Steve, Thailand Adventure. So his question is, okay, so realistically speaking, COVID will stay with us for a little while and it won't magically disappear.
Correct.
So how do we change the way we deal with it, and how is it time to manage it the similar way as we did in the past with numerous flu virus variants?
Well, I suppose you could say that the coronavirus has got a higher death rate than a flu. It's still only around about 1 to 2% from all the statistics we've seen, but when you extrapolate that across the world population, that's still a lot of people. And so, I suppose the word manage is, I suppose, coming into the lexicon more than the word contain.
Okay.
My feeling is that the governments around the world need to start looking at managing this. Obviously, the care for people, the drug management, the whole understanding of the way the virus works is we're gaining knowledge all the time. So we are entering into a stage where we've got to get these vaccines out. New vaccines will come along. There will be boosters for different variants, and we're just going to have to just keep on sticking at it. We're not out of the woods yet. I mean, we are having to learn to manage this situation. The tourism sector's the sector in the world that's really going to suffer, though, is where the whole world is just slowed down and not moving.
Yeah, so hospitality, airlines, so anything that involves mobility and also, tourism and hospitality is really affected hugely. But you're right, Tim. So, they have upped their game in terms of like hygiene and safety measures to help contain the virus. So we are improving from time to time, and there will be better and improved solutions
I think
as we go along.
All the way from the Spanish flu like 100 years ago through the other different outbreaks we've had over that 100 years, the things that stand out are social distancing, hygiene, and wearing face masks. Now, they do work. I know a lot of people, especially in the United States for some reason, have got a real thing about wearing a face mask, and it's turned into a political imperative for some people. But wearing face masks does reduce the transmission from one person to other people. And so we need to just follow the science in this regard. And I think there's going to be just a lot more of those three things into the future as just part of our life. Gordon says, do you think that all entry to any foreigners wanting to come to Thailand will be banned if the COVID cases go up, same as what's happened in Indonesia? Well, we don't know what's going to happen at today's meeting. I don't think they're going to stop or curtail the current Sandbox. I don't think they're going to postpone what's happening in Samui. I don't think they're going to ban foreigners from coming into Thailand. I think they are going to try and manage the situation, but there will be restrictions. Yeah,
exactly. I think we're in the step in the right direction. There will be teething problems, there will be some issues arising, but we are managing as we go the best we can. And so far, so good, that they, so we are trying the best we can. And I've got a question here from Mango Sticky Rice saying that so I think people are also interested to know what are the breakdown of, the countries that are coming into the Sandbox. So where they're coming from. So I believe they're coming from the Middle East, Singapore, as well as, what are the other countries?
I don't know. Israel. We had a lot of Israeli people the first flights.
Yeah, for the last week. So
it sort of depends a bit on the aircraft that are coming into the country at the moment. So the UAE, I think there's 3 different airlines flying into Phuket directly. Singapore's got 1 flight a day, I think, through Singapore Airlines. Yeah.
Correct.
So it is determined a bit by the flights that you can get. But I understand some more airlines are looking at adding flights as the Sandbox rolls out. But it's a good question. We'll try and get a bit more information about where people are coming from with the current Sandbox. A comment here, where was it? Does Thailand allow mixed dosing tourists? Some Canadians have 1 Moderna and 1 Pfizer as the second. I understand there has been a modification to the certificates of entry where they will allow the mixed doses in some cases. I just saw a quick infographic yesterday on that, so we'll try and bring you up to date on the Thaiger.com with that information. But I did see something yesterday, and I made a mental note that they have changed the allowance for mixed vaccines. What the mixes are and what they're allowing, I don't have that information. But good luck. Thanks for the question, Jeff.
Yes. Okay, so I've also got here from Malcolm. His question is, what financial assistance does the Thai government currently provide to its people during this situation? So I know that the vaccines are subsidized by the government. So
they're free.
Yeah, exactly. And also to foreigners as well. And now they've extended that to foreigners without work permit as well. So that's all free.
But they will have to wait. So for foreigners who are desperately trying to get vaccinated at the moment, and we would get 20, 30 emails every day, people really wanting to get vaccinated, that is not currently available. And you just have to register on things like thailandintervac.com and just be patient. They will get there, but there's a vaccine shortage.
Yeah, that's right. And now they've also introduced Moderna, which is a paid
Can I just address that, because I had a bit of a long conversation with a gentleman yesterday about these vaccines. The private vaccines, hospitals are now saying, you can get your vaccine, register with us and prepay. Now this is, to me, a bit of a cash grab, because these Moderna and Pfizer vaccines that the government's going to be bringing in later in the year are not in the country at the moment.
No.
The actual official orders have not even been made. So if you want to register with a private hospital and pay up front for something that hasn't even arrived in the country, that's entirely up to you. We're not going to publicise that that's happening, though, because we would rather prefer to give information to you about something that's real rather than things that are just a plan or a proposal. So those private hospital vaccines, they're not in the country yet. Some of the hospitals are saying you can register now and prepay. That's entirely up to you.
And I heard that it's a limited supply as well.
Yeah, but they don't even know what the supply is yet, because they haven't arrived.
Yep.
Okay, what else we got? One more question for you, one more from me, and we'll wrap it up for the day.
Okay, so one here from... let me just quickly...
Okay, Steve asked the question, you have very interesting co-hosts. Is there any plan for them to have standalone videos? So, the Sumi Surian show coming to you from a bar near you.
It won't be the same without you, Tim.
No, we're not really looking to extend the amount of videos we're doing at the moment. We're finding it hard enough to get this program and Thailand News Today out every day as it is with our tiny team of people. People like Sumi come here really just out of the goodness of their heart to help us. So we're very grateful for people like Sumi popping in. I don't think Sumi's looking at a full-time hosting career at the moment.
Thanks. Okay, so this is a question from LK. Under the Sandbox regulations, only adults and not kids, actually not under 18, they're under 6, need to under 18 needs to go through all the COVID tests. So that is true. So you do need, for any travels, including domestic as well, within Thailand.
But kids under 6 are excluded from having to have a test.
Yes, under 6 is excluded, correct.
Yes. Okay, one final question here, completely randomly, just came up from Ronald. I hear that entertainment venues are still closed. Does that mean also Phuket Fantasy and Siam Niramit stay closed as well? Yeah, I drove past Phuket Fantasy yesterday and it was closed. Same with Siam Niramit. And I was thinking, what's happened to the animals? Because those shows have got elephants and tigers and goats and ducks and chickens and pigeons and all sorts of paraphernalia. They're great shows, by the way. If you are in Bangkok, make sure all Phuket catch Siam Niramit. And here in Phuket, they've got the Phuket Fantasy Show. I think there's other big shows like that in Pattaya as well.
Yes.
Have you been to these shows?
Yeah, when I first arrived to Phuket, yes, it's kind of like you have to do it once.
You have to go. And anytime I get foreign guests coming, I always take them to see one of these big shows because they're like nothing you will see anywhere in the world.
It's a cultural show, so it shows you a lot about the country.
But occupational health and safety, forget about it. There's people on ropes and flying around. It's completely bizarre, but you just have to go and see these shows. But they're not running at the moment.
No,
Sad.
I think they need the numbers as well. I mean,
Of course.
those venues are
They're
huge,
huge,
and they're
yeah.
mass.
I think the Siam Niramit Theatre holds about 4,000 people.
Exactly.
So we don't even have 4,000 foreigners on the island at the moment, or 4,000 visitors. Okay, question. Why doesn't Tim mind his business? Clearly not an expert on US mask requirement. Well, I mean, I think in some cases masks are required in America. I think you have to wear them on planes, and I think different states have got different rules. But the point I was making about in America, it's become a polarised situation where your political bent tends to determine your opinion about mask wearing, and that was the point I was making, where it should be, of course, a health matter and not a political matter. Any more questions from you?
Yes, so this is from Dana. So don't under 6 need a spit test upon arrival.
A spit test?
I don't know what a spit test is. Is it the swab? No, so under 6 children do not need to go through any test.
And Genkin, one of our members, thank you Genkin, says Blue Tree has opened. A Blue Tree is a big sort of theme and...
Water lagoon.
Yeah, it's a big
Retail,
lagoon, water park,
dining.
retail. It's quite a stunning place. They've opened. I don't think it's fully open at the moment, but they have opened. Of course, a lot of places have opened in Phuket to try and provide an experience for the tourists that are arriving here. At the moment, it's just a bit of a dribble, but we're hoping it will slowly open up. All right, so that's probably it. Unless you've got anything urgent there?
No, maybe we'll take one more question. So
Okay.
this is from Bilal. So question is, talking every day about the same topic, so he thinks it's quite boring. So can you talk about jobs available for foreigners, highlight the opportunities, for example?
Well, I think we've got to get foreigners back into the country and allow them to come to the country freely before we can talk about offering jobs for foreigners.
I think it's hard enough now, even for
Yeah.
local, let alone foreigners.
Sadly, the narrative in the news really at the moment is everything that's being caused by COVID, the restrictions on business, and this is having a profound effect on people's lives. And it's our duty to talk about these things. And whilst it's great to talk about jobs for foreigners here in Thailand, at the moment, I think a lot of Thai people are battling to keep their job as it is, and foreigners are probably going to be a bit down the line. But certainly something we'd like to talk about in the future when things settle down a bit. All right, with that, we'd like to say thank you very much, Sumi, for coming in.
Thank you, Tim, for having me this morning.
And thank you very much to all the people who have responded, commented and complained and asked questions. We've done our best to answer them as honestly as we can. Thank you very much to Jay and Jason and to the staff here and Bjorn at the Intercontinental in Kamala. Thank you very much for being generous hosts. We're back in the studio next week. Are you coming in next week?
Of course, if I get an invitation.
We don't make good coffee there in the studio, though. And we don't have the nice baked croissants, but we'll do our best. Thank you for watching, and thank you for being with Good Morning Thailand for this week. And from all of us, we wish you a fantastic weekend, and we look forward to seeing you again soon.
Thank you, Tim. And the sun's out.
Oh, the sun's out.